This is your next task, and this is the only slide you have, and your 2 minutes begins now. Please start.
Hello, I am Dr. Simi, one of the doctors in the gynecology clinic. Am I speaking to Amy John, 24 years old?
Yes, that's me, doctor.
How can I address you?
You can call me Emmy.
Okay, Amy. Amy, I see from your GP letter that you are here because you are planning to end your pregnancy by doing sterilization. Am I right?
Yes, I want to get this procedure done for me, doctor. I want permanent method for me. Yeah, that's why I'm here. I want to go for the procedure.
Okay, I understand that, Emmy. Emmy, what is your thought about this procedure? What is your idea about this procedure?
That I checked it on internet. It appeared to me that it's the permanent method. So after this procedure, I am not going to have kids, and I don't want to have kids. So that's why I don't want to. I want to go for this procedure.
Okay, your understanding is right, Emmy. So we will discuss about it in detail. Before that, is it okay if I ask you a few questions so that I can explain you everything in detail, and finally we will together make a safe plan for you. Will that be okay, Emmy?
Yeah, yeah, that's fine.
Okay, Emmy. How many children do you have?
I don't have any children, but I don't want them in the future as well.
Okay. So, Emmy, how is your menstrual cycle?
That's regular, very much regular.
When was your last menstrual period?
2 weeks back.
Okay. So, Emmy, pardon me asking you a personal question. Are you sexually active?
Yes, I am sexually active. I live with my partner, and everything is fine there.
Are you do you in stable relationship with your partner?
I don't know about the stable, but yeah, I am in a relationship. It's a good relationship.
Do you have any other partners before?
Few in the past, but for last 2-3 years, I'm with this partner, and we are very happy together.
Okay. Are you using any birth control methods now?
I tried using those pills, but I tend to forget them, so I don't like that much. And I've used condoms, yeah, on and off, but they are not very reliable.
Okay, okay. So, do you have any other medical problems?
No.
Any other surgeries on you?
Yes, doctor. Last year I had a surgery. I had this pregnancy that the doctors told me is an ectopic pregnancy. It was a really very bad experience for me, chaotic. I fainted. I was taken to the emergency. These people told us that my tummy is full of blood, and I was taken to the theater immediately. They did surgery on me. Oh, it was such a nightmare.
Oh, I'm really sorry about that, uh, Ami. So, it was. How was your post-operative recovery?
Yeah, I recovered well. I had few blood as well, but otherwise recovery was fine.
Okay, okay. So, do you have any allergy?
No,
And what is your blood group?
O positive.
Any reservation against blood transfusion?
No, no.
So, what about your weight height ratio?
It's normal, 24, I think.
Anyone in your family have any medical concerns like clot in the leg or anything like that?
None. No one.
So, how is the support at home and from the partner?
Yeah, my partner is very supportive.
Okay. Um so, are you feeling low or depressed recently?
No.
Okay, Amy, thank you for all the information. Amy, you are you have a history of tubal pregnancy, and for that surgery was done. Uh, do you have any clinical notes about that surgery? Any operation notes are with you?
Not now, but I do have them. Yeah.
What they told you, whether your tube was removed or only the pregnancy was removed, anything like
Yes,
that?
they told me that it was on my right side tube and the tube was removed at that time. So,
Understand.
but they told me that there is a chance of it happening again, and that's why I don't want to take any chance, like any chance at all. So, yeah, that's why I'm on this procedure to be done on me.
Okay, I understand your concerns, Emmy. Emmy, so you are now planning for ending your pregnancy. That means ending. You don't want any children further, right?
Yes, no children, no pregnancies, no risk at all.
Okay. Are you aware of any other method of birth control method like anybody discuss about this you before?
I was discussed about certain methods. The pills that I told you is not, I don't like them.
You
And others, I don't know. What else is there?
what happened when you took the pill? Is there any problem like any nausea, vomiting, anything like that?
You have to forget them. That's it. I cannot take them on the daily basis.
Okay, okay, I understand that. So, Amy, in your case, you are only 24 years. So you don't have any children. You are in a stable relationship now. Uh, so, before discussing about so I will discuss you about all the options available for you to prevent the pregnancy. After that, you can make your choice. We always respect your choice. Will that be okay?
Yeah, but I think I have made my mind that I won't, don't want any other further pregnancy. Still, you want to tell me you can go.
That means you are planning for this sterilization. That means it is a permanent procedure. It is a surgical procedure. Okay. First of all, I will explain about that. It is the surgery we will done usually through a keyhole method. Here we will take the tube and we will put some ring in the tube. Since you have only one tube will be blocked. Okay. After that, this will be blocked, and it is the reversal of this is very difficult. Even though if you are done doing the reversal, the chance of pregnancy is very less. Okay, and after that, the chance of tubal pregnancy is also more. Hmm? Are
So
you
you
getting
mean
me?
that if I go for this procedure, there's a chance of tubal pregnancy?
It's not like that. If you are going for this procedure, and if you are not, if you are planning for a reversal of this procedure later in a later life, if you are planning for a
I'm
child
not
in a
going to
later.
plan for the procedure. Plan for reversal of this procedure. No, I'm not. Don't want the reversal.
Okay, okay. So you don't want to. You are very. You are very sure that you don't want any children in the future also.
Yes, I do. I'm sure about it.
Okay, okay. So okay. So about this surgery, it is a permanent procedure. It is reversal is very difficult, and during the surgery, since it is a surgical procedure, it has its own risk is there. Like since we are doing it through the keyhole after filling air inside your tummy, there are certain common complications and serious complications are there. Are is it okay if I discuss about the risk associated with the surgery?
Yeah, sure.
Okay, and during the surgeries, there is chance that there is pain, shoulder tip pain, and some infection can happen. Sometimes the, the failure of this procedure can happen. If the failure happens, it might be result in a tubal pregnancy. Okay, and also there is chance of injury to the surrounding organs like bowel, water bag, all this can happen, but don't worry, it will be done by expert doctors. Everything will be taken care of. We'll do our best to prevent all these complications. I'm telling all these things to make you understand about the exact what is this procedure in detail. So after this procedure,
Okay.
it is usually you can. Okay.
So, you guys have just seen the candidate presenting this case. Let's now take a moment to understand this task and look at the ideal way of approaching it. This is a negotiation style simulated patient consultation where a 24-year-old woman is requesting sterilization. Your job as the candidate is to take a focused, relevant history, explore her reasons, clarify her understanding, and counsel her safely and guide her towards shared decision making. Let's break down how this task should be done step by step. First, let's look at what the examiners are assessing in the station. This task is not just about giving information, it is about how you communicate, how safely you counsel the patient, and how well you explore her concerns. The core domains being assessed are information gathering, effective communication with the patient, communication with the colleagues, ensuring patient safety, applied clinical knowledge. Keeping these domains in mind helps you structure your consultation and ensures you cover all the essential points. Let's try to understand the patient we are dealing with. Amy is a 24 years old woman who previously had a traumatic ectopic pregnancy requiring surgery. The experience has deeply affected her and she is now strongly determined never to become pregnant again. She believes sterilization is the only permanent and reliable solution and she wants the doctor to arrange it quickly. She is unaware of the failure rate or the increased risk of ectopic pregnancy if sterilization fails. She finds the pills difficult to remember and feels condoms are unreliable. Let's start with introduction and building the rapport. Always greet the patient, introduce yourself as one of the gynecology doctors, confirm her name and age and how she prefers to be addressed. Establishing the purpose of the visit is extremely important, so tell her that I'm aware of your GP's referral, but I would like to hear it from you as well. Could you please tell me in your own words what brings you to the clinic today? and reassure her that you're here to give her the full information and confirm that her wishes and choices will always be respected. That reassurance is extremely important. Try understanding her background and expectations. So tell her that you would like to understand her situation better. So you need to ask few questions. And always start with an opening question about sterilization request. You can frame something like, could you tell me why you feel sterilization is the right choice for you now? So this will help you understand what is the hidden agenda, why this particular woman is requesting for sterilization. So try exploring her reason early in the consultation, which is extremely important. It helps you understand her main reason or agenda behind requesting sterilization. She may choose to share it openly or she may not, but this question gives you a foundation to guide the rest of your discussion. So try to ask this shortly after your greeting, introduction, and reassurance that her wishes will always be respected. Asking this early in the consultation will help you understand what is the main reason or agenda behind requesting sterilization. So as far as your information gathering goes, start with obstetric history, previous pregnancies, number of pregnancies and their outcomes, any history of miscarriage or an ectopic pregnancy, the details of ectopic pregnancy, when did it happen, which side was affected, and how it was managed, whether it was managed as a keyhole surgery or an open surgery, whether the fallopian tube was removed or preserved, any complications during or after surgery, did she require any blood transfusion. It's equally important to understand her recovery both physically and emotionally, whether she has any ongoing symptoms such as flashbacks regarding this traumatic ectopic pregnancy. If that has led to have this emotional or psychological impact, whether she's seeing any counselor or receiving any sort of psychological support, it's important to know that. And try exploring and link this event to the current request, whether this previous ectopic pregnancy and the trauma around it has influenced her decision not to try for another pregnancy, which is extremely crucial in this scenario. Complete your routine history, including gynecological history, cycles, any heavy periods, dysmenorrhea. Signpost and ask sexual history, whether she's sexually active, and how is the support from the partner, the current contraception use and difficulties, history of STIs. History of STIs becomes important patient safety point in here if she is convinced that sterilization is risky, and if she chooses to have a coil or a Mirena, it's important to know that history and do swaps for her before we do intrauterine contraceptive device, which is important in her scenario. Complete your routine history, including medical history, medications, allergies, surgical history, family history, addictions, BMI, blood group, reservation to blood transfusion, and mental health if you have not covered the mental health earlier. Coming to exploring her concerns and understanding, I tell this to everybody. Exploring ideas, concerns, and expectations is extremely important to understand her deeper concerns and motivations. Acknowledge that her previous ectopic pregnancy may have been traumatic, and explore whether this has influenced her decision not to become pregnant again. So you can put it something like, it sounds like your ectopic pregnancy was a very difficult experience. Has that influenced your decision not to have any more pregnancies? Or you can say, can you tell me what worries you the most about becoming pregnant again? And also try and explore what she understands about the sterilization as a procedure. She may say that this is permanent in nature. This is why I want to get this done, because I don't want to become pregnant in the future. So this will help us to set an agenda. So we have identified there are two key misconceptions that must be addressed during the consultation. She believes sterilization guarantees She will never become pregnant again because she thinks this is 100% permanent. And she believes sterilization will completely protect her from another ectopic pregnancy. Not necessarily an ectopic pregnancy, she thinks that any type of pregnancy, it will protect entirely. So now our job is to clarify her misconceptions, and that is the agenda of this entire consultation. So having said that, it's important to take her through what she is requesting for at the moment. She wants to get the sterilization done. So try and telling them about the sterilization. Do not start with your long-acting reversible contraceptives. First, give them the information about sterilization. So sterilization is a procedure where we do it through keyhole surgery under general anesthesia, meaning you will be fully asleep. The fallopian tube, so if the right tube is left behind, if that is the one tube which is there, that will be either clipped or cut and tied to permanently block them. Most women go home the same day with a shorter recovery period. Because you have had a keyhole surgery before and you mentioned a history of sexually transmitted infections, the tissues inside your pelvis may be stuck together due to scarring. That can make the operation slightly more difficult. In that case, we may not always be able to complete the procedure using keyhole surgery. We may need to convert to an open surgery, which involves a slightly bigger cut on the tummy. Any procedure for that matter comes with its risks and complications, which include infection, bleeding, injury to nearby organs such as the bowel, bladder, ureter, and the need for further surgery or blood transfusion if complications occur. And check her understanding after giving this information chunk. Am I clear so far? It's important once you tell her about sterilization and the risks and complications, she will be okay with that. She will not resist, by saying all this information. She will be still intending to go ahead with a sterilization. So now it's important for you to take her through important facts about sterilization, which are: it is permanent but not 100% guaranteed. If it fails, the risk of ectopic pregnancy is higher. And the nature of irreversibility and possibility of regret. And no STI protection. And you also have to tell her about the reversal of the procedure and NHS funding considerations. Having said that, it is permanent but not 100% guaranteed. This is the first negotiation you are doing. Sterilization, yes, it is permanent method. However, it can fail in about 2 to 5 per 1,000 such procedures. Even though failure is rare, it can still happen. If it fails, the risk of ectopic pregnancy is higher. A pregnancy after sterilization is more likely to implant in the fallopian tube, leading to another ectopic. So, sterilization does not remove the possibility of a repeat ectopic. The risk is actually higher in case of failure, so you may face a similar situation to what you have already been through. And the third is irreversibility and possibility of regret, especially when the procedure is being done at a younger age, less than 25 years of age. And it does not protect against sexually transmitted infections, so she has to continue with the barrier methods. And the last one, reversal of the procedure. Once done, it cannot be reliably reversed, and the reversal involves major surgery, adhesions, and more complications. Even if reversal works, pregnancy is not guaranteed and risk of ectopic remains. An IVF may be needed if reversal fails, and reversal is also not funded by the NHS, and IVF is also not routinely NHS funded for women who previously underwent sterilization. And have that empathetic summary before offering alternatives. Tell her that I'm not telling you all of this to upset you. I want you to have the full picture so you can make the most informed decision for yourself. I know it is difficult to hear that sterilization is not 100% effective, and that even after the trauma of an ectopic pregnancy, there is still a higher chance of another ectopic if failure happens. And take her through the next alternatives. Once you say all these reasons, once you quote all these reasons, naturally she will incline towards listening to other alternatives, because she now understands that this is not 100% effective. There is still a failure rate of 2 to 5 out of 1,000 such procedures, and if it fails, there's a higher risk of ectopic once again. So once she listens to you, naturally she will be ready to listen to you about the alternatives. So you can tell her that this is exactly why I would like to go through the other options with you, some of which are almost as effective as sterilization but safer and reversible. Would you like me to take you through those options? And definitely she will be ready to listen to you. So you can offer her other long-acting reversible contraceptive options. So tell her that we have long-acting reversible contraception options that are almost as effective as sterilization but much more safer and fully reversible. Available options are hormonal injections that can be given every 3 months, implant which is placed under the skin of the arm, lasts for about 3 years, which requires a small procedure. Intrauterine contraception coils, we have copper coil, which is non-hormonal, lasts up to 10 years, and then we have got hormonal coil, what we call Mirena, lasts up to 5 years. And tell her the advantages. They are highly effective, reversible in nature, no need to remember like daily pills. However, she has to continue with the condoms because these are the only barrier methods which can protect her against sexually transmitted infections. And also tell her if she chooses to have a copper coil or a Mirena, we need to do an infection screening, and also given the history that she has had a chlamydia earlier, we need to check for any current infections. We may have to swab her, and if needed, treat her with antibiotics before insertion. The OSCE strategy here is that how to present alternatives when time is limited, because you have already taken the history and you tried exploring her ideas, concerns, and expectations about the sterilization procedure, and you tried telling her what sterilization involves and what are the risks and complications, and so you have told her so many things. So at times you may run out of time, and the time is short, so avoid giving long lectures. So your aim is to mention other options, the alternatives, then ask what she wants next. So you can just say that you can just tell the headings that these are the main long-acting options available: injections, implants, intrauterine devices. So you can ask her, would you like me to explain all of them briefly, or is there one option in particular you are more interested in? So you can give her the option. So that will help you save time and stay patient-centered, which fetches more marks. And if she wants a quick overview, if she doesn't choose any one, then you can just tell in one line that we have got an injection every 3 months, and then we have got an implant, which is a small rod that will be placed under the skin of your arm, which works for 3 years, and then we have got coils and which will be inserted into the womb. We check for infection before inserting it. It works for up to 10 years, and then we have got Mirena, which works for 4 to 5 years and also reduces period. So you can just tell them in simple lines and you can move forward. And close the consultation in such a way that you are focusing on a shared decision making. So you can tell her that you don't have to decide anything today. I'll give you the written information on sterilization and all these log methods. You can take these home, read through them, discuss with your partner or family, and decide what feels right for you. Whatever you choose, we will completely respect your wishes. So with that, you can complete the task, and you can also tell her that you would document the consultations we had today, and I will write back to your GP, and I will also inform my consultant. So that way you are getting marks under communication with the colleagues. At times, the patient becomes defensive. That happens only when the student tries to tell that no, 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 this is not very safe for you, you're very young, and this involves so and so procedure, this is very risky, you have got better alternative options such as lark. So when you try to do that right in the beginning without taking her through the sterilization, what it involves and what are the things which we are worried of, if you just start with saying the negatives, she might become very defensive, and she might say, it's my body, who are you to say this, I have decided I want a sterilization, just tell me about that. So try avoiding that. But if that happens, try to remain calm and tell her that you're absolutely right, this is your body and your decision, my role is to make sure you're fully aware of all the benefits, risks and alternatives before making your final choice. Always remember, guys, in the negotiation task, give them what they want to know in the beginning. Then take them through the pros and cons, and then naturally they will be interested to know the alternatives. Once you explain each and everything, there won't be much of resistance in the beginning when you tell them what they want to know or what they want to hear at the first. So, summarize the key points as discussed and tell her that your request is taken seriously. I respect your decision, but I want you to be fully informed before proceeding. And so give her the written information and fix a follow-up appointment. And you can even refer her to the counseling services if she wishes. If she's already seeing the counselor, that's all right. And end with a supportive tone. Tell her that I hope this discussion has helped you. Take your time to think about it, and we can review this together at your next visit.